medicine and toxicology. It's been written as forensic medicine only in your as a subject, but full subject to Nanse, it's not just forensic medicine, but it's forensic medicine and toxicology. Toxicology company or certain parts which we will be reading at the end. So the last toxicology portion. This is full subject to Nancy, forensic medicine and toxicology. All right. So as I've already mentioned in your orientation class, that two of the faculty will be taking your lectures. On this subject, me myself, and one visiting faculty will be here. Okay, so apart from that, you'll be sent for practical classes, as already mentioned. Ani त्यसमा पनि certain part of theory will be covered, so you'll be more clear while attending practical classes. But again, before attending practical classes, you have to know certain part. Okay, फेरि त्यहाँ गएर clueless is not good. So as you already know, अरू सब्जेक्टहरुमा जस्तै it's a very sensitive subject. So again, you have to know certain few things before attending practical session. So initially we'll be talking about what is the subject itself. Today's topic would be basically on what do you mean by forensic medicine, what are the branches of forensic medicine, what are the what are the specific objectives, chapters include गर्नुपर्ने तिमीहरूले पढ्नुपर्ने त्यो छ हैन त्यो बाहेक if possible we will be reading a little bit about the medical legal system of our country, right? So before starting our topic, I would like to know if any one of you have any idea about this subject, forensic medicine को बारेमा कसैलाई केही थाहा छ कि छैन कि clueless हो कि, but I'm sure you know what it is. So if you can volunteer an answer, I would be happy. What do you mean by forensic medicine? के आउँछ दिमागमा फोरेन्सिक मेडिसिन भन्ने बित्तिकै के आउँछ दिमागमा? भन तिमीहरू छौ कि म भिडियो अन गरेर भन्नु? Or should I call your name?
Ma'am, study of dead body to find cause.
Okay, cause what? Cause of what? Yes, I was.
Cause of death, ma'am.
Okay, cause of death. Very good, Shruti. Yes, it's basically तिमीहरूले अब देखिरा होला, न्यूज पढिरा होला हैन, मिडियामा आउँछ धेरै जसो जहिले पनि के रे कुनै पनि अननेचुरल डेथ भयो भने body will be sent for autopsy or postmortem to find out the cause of death. Basically to find out the cause of death. Now, यति मात्र हैन, cause of death मात्र हैन, we have to know when did it occur, time of death पनि थाहा पाउनु पर्यो, अनि how did it occur, was it due to accident, suicide or homicide. So these are few questions that is answered by examining the dead body. So Shrutile भने जस्तै it's not just related with dead body, but again it is also related with living as well. अब कुनै पनि incident जस्तै sexual assault को incident, rape भयो हैन, again a person or victim or even accused Perpetrator as well as victim is sent for examination to find out if rape has really occurred or not. First question, if so, what are the evidences that you can acquire by examining the victim, so these are also related with forensic medicine. So it's not just related with death, it is related with living as well. So going further, what are the topics that need to be included, Madze? You have to know about injuries. Okay, I will be sending you the topics. CR को Viber मा म पठाइदिन्छु टपिक्सहरू, you can go through it. अनि म every class को end मा next topic के हुन्छ भन्छु, and you have to be prepared before coming to class so that you can at least have some idea. मैले केही सोधेँ भने तिमीलाई exact answer चाहिँदैन मलाई, but you should have some ideas before attending the classes. All right, so you have to know about injuries due to injuries and other injuries due to other explosive forces such as firearms as well, craniocerebral injuries, asphyxial death, infant death, non-accidental injuries in children, child abuse, transportation injuries, and disaster planning, burns and conditions related to heat and cold, electrical injuries, sudden and unexpected death, sexual assault, examination of sexual offenses, identification of human remains, toxicology, common poisons in Nepal, venomous snakes or snake bite. So this objectives is written according to your curriculum, right? Not according to your chapters. Book ma bhako jasto chapters सँग छैन, according to curriculum के तिमीहरुको included छ topics हरु. Alright, mushroom poisoning, torture, abortion, pregnancy and delivery, age estimation, drunkenness, forensic psychiatry. And these are the topics. Okay, अब मैले अघि forensic medicine भनेर सोधेँ के हो भनेर, हैन? So how did this term derive भनेर भन्दाखेरि चाहिँ forensic medicine is also known as medical aspect of law, where this word forensic has derived from forensis. Forensis को meaning के हो भन्दाखेरि चाहिँ it's a Latin word which means forum, because in ancient time in Rome there was a forum where there was a meeting place, okay, and civil and legal matters used to be discussed. So one thing you have to know is that अघि तिमीले भने जस्तो know the cause of death. Why do you need to know the cause of death? So that justice can be done, right? So it's related with law as well as medicine, right? त्यो कारणले गर्दाखेरि we even call it legal medicine in Europe and some part of USA. Synonym चाहिँ it's legal medicine. Forensic medicine भनिँदैन कि legal medicine भनिन्छ. So when we define forensic medicine, it's defined as it deals with the application of medical knowledge to aid in administration of justice in court of law. So के गर्ने त किन पढ्नु पर्यो त as a medical student? Why do you need to know about forensic medicine भन्दाखेरि whatever knowledge you gain in your medical school, right, from basic sciences to 5th year final year सम्म, whatever knowledge you have, you apply that knowledge, application of medical knowledge, and which further aids in justice in the court of law. All right, so you help the legal system by application of your knowledge. For example, after doing postmortem or autopsy, you see some kind of injuries, by studying that injury, by knowing the type, size, site of that injury, you know how did it occur. Was it an accidental injury, or was it some kind of abuse had been done? right? So you document the type of injury, the size of injury, and most important, causative weapon of the injury, right? So you write it down and you give your opinion according to your knowledge. Not you cannot assume uh, or make your own hypothesis and give your opinion. That's not allowed. You give opinion according to your knowledge and according to your documentation, right? And that would be sent to the police. Further, it goes to court of law, and then with the help of your opinion, justice can be done, right? So if you understand this, then you'll be able to define forensic medicine, that is, application of medical knowledge to aid in administration of justice in a court of law. जुनै पनि सब्जेक्टको definition is very important, because written ma naala what is forensic medicine भनेर written ma आउने, it's very too easy. तर viva ma mostly it starts with this definition of forensic medicine. You have to know your subject before going further. All right, so this definition is very, very important. Please go through it and please try to understand so that you can remember it for a lifetime. Next is forensic medicine is a branch of medicine where principle and knowledge of medicine is used for purpose of law. Okay, this definition is regarding the this is not definition of forensic medicine, is medical jurisprudence. Please correct this thing. Medical jurisprudence is a branch of medicine where principle and knowledge of medicine is used for purpose of law. Am I clear? Please delete this forensic medicine. Use medical jurisprudence. Medical jurisprudence is a branch of medicine where principle and knowledge of medicine is used for purpose of law. It can be civil and criminal justice. Okay, we have gone through the specific objectives. I think I missed out this Nepalese legal provision related with the practice of legal medicine and practice of medicine as the whole in a country. Okay, so we will be talking about medical legal system of a country, and you have to know the medical legal system going further in the subject. Okay, so further, what are the branches of forensic medicine? First and foremost is forensic pathology, where you have to have a knowledge of medicine to find out the cause of death by performing autopsies, post-mortem examination. Okay, and who does it? Forensic pathologists are medically qualified doctors who perform autopsies on those who have died suddenly, unexpectedly, or as a result of trauma or poisoning. All right. So, who are authorized to do autopsy? Like any expert, such as forensic pathologists, are qualified doctors. But again, due to the lack of manpower, it is not so in our country till date. It's not necessary that an expert should perform autopsy. So any qualified medical doctor who is trained for this autopsy, just you will be qualified after going to for autopsy practical classes, as well as after you complete this third year, you will be qualified. So whoever is medically trained for autopsy can do autopsy. All right. So that is forensic pathologist. And why do you need to do autopsy? To basically to find out the cause of death. Next is what are the issues raised by death? You have to not just, you have to find out the cause of death. you have to identify the deceased as well. कतिवटा cases identification is very, very less possible. For example, in air crash, you cannot identify the body. All right. If the body has been found after a long period of time and only skeletal remains are available, how will you find out? How will you find the identification? So it's not just finding out the cause of death, but again, identification of the deceased. Cause of death, what is the cause of death? Was the cause of death due to some kind of injury? Was the cause of death due to hanging? Was the cause of death due to burn? So you have to find out the cause of death. Interpretation of injuries. अघि मैले हल्का भनिसकेको छु होइन. How do you know the injuries? Body has been brought. How do you know that person has died due to hanging? Or how do you know the person has died due to some kind of natural disease or due to some kind of injuries? Okay, so you have to interpret the injuries. How do you interpret? By studying about injuries, what are the types of injuries and what are the causative weapons on certain kind of injuries. Manner of death, again, cause of death from manner of death is different. Okay, manner of death can be natural, accidental, suicidal, or homicidal. Okay. So can anyone say what is natural death? Natural death भने के होला त? You can just use your brains, brainstorming गर भन natural death भने के होला? What do you think natural death is? यति त थाहा.
डिजिजले गर्दा.
Okay, कोले भनेको answer. I'll be noting down है तिमीहरुको कोले answer दिन्छ.
The course of life ले गर्दाखेरि नै अनि त्यो death आएर चाहिँ भयो.
You mean to say due to some kind of diseases or due to age factor, right?
Yes.
Okay, aging, and very good, Sukriti. Anyone else?
Diseases such as MI, carcinoma.
Cause of natural causes. And of natural causes.
Okay.
Disaster victim.
All right. That's good. So natural death भनेको due to some kind of disease or some kind of disease or some kind of aging ले गर्दा हुने चाहिँ natural death. Unnatural death भने के होला त? So natural भन्ने बित्तिकै unnatural पनि आउँछ. Unnatural death भन्ने के होला?
Accident.
Okay, accident.
Poisoning.
Homicide, suicide.
Okay, so that is all about unnatural death. Accident, homicide, or suicide. Poisoning, hanging, no bana. Poisoning can be accidental, homicidal, or suicidal. Three times. Hanging no bana. Suicidal, or homicidal. Even accidental. So unnatural भन्ने बित्तिकै accidental, homicidal, suicidal भयो. Natural भन्ने बित्तिकै some kind of aging or disease ले गर्दा. You know the disease. A person is suffering from cancer, so you know that even age नभए पनि 18 years भए पनि can be a natural death due to some kind of disease. All right, so natural or unnatural. And unnatural मा पनि अर्को एउटा death पनि हुन्छ, that is suspicious, unexpected, sudden death. अघि तिमीले notice गर्यो भने एउटा हाम्रो topic पनि थियो, sudden unexpected death. All right, about a person was one incident recently happened to a star, that a person was very much fine, fit and fine when he went for his sleep, and when he woke up he was found dead. Okay, so that was very much unnatural. Unnatural bhanda pani suspicious. You might be following the media. त्यसमा पनि autopsy गर्यो हैन, though it was a natural death, cardiac arrest is a natural death, but it was again suspicious and unexpected हैन, त्यो कन्डिसनमा पनि you have to do autopsy. Alright, so चारवटा कन्डिसनमा गर्नु पर्यो, that is accidental, homicidal, suicidal गर्नै पर्यो, त्यो बाहेक unexpected, sudden, suspicious death. Alright, अनि natural death मा चाहिँ to rule out if it's a natural death, again that is to be done, but normally in natural death autopsy is not done. Okay, next subject is clinical forensic medicine. I have already mentioned that it's not just related with death, but it is also related with the living as well. For example, examination of sexual offenses in rape cases, estimation of age for medical legal purposes. Now, age estimated is very, very important. Kina important छ भन्दाखेरि धेरै कुरा age सँग related छ, medical legal issues हरु. For example, एउटा rape को definition मा, even if it's a consensual sexual intercourse, if a female is less than 18 years, it is regarded as rape. Okay, so to rule out if she is 18 years and above or below, you have to do age estimation. Okay, त्यस्तै अरु पनि issues हरु हुन सक्छ, जस्तै अब if there is child labor छ भने पनि हैन, certain age सम्म child labor is regarded as illegal. For that purpose as well, age estimation is done. So there are various issues where age estimation is to be done, and it is included in clinical forensic medicine. Similarly, paternity dispute cases, as you already know that there are cases of illegitimacy. There is now these days there are artificial method for parenthood. अब paternity को cases आउन सक्छ, maternity को cases आउन सक्छ हैन, त्यसले चाहिँ property dispute हरु हुन सक्छ, civil cases हरु हुन सक्छ, त्यो cases मा पनि again it's included in clinical forensic medicine. Examination of injuries in physical assault, battered baby or drunkenness. Okay, injuries is not just examination of injuries is not just done in cases of a dead body, but even in living, if there is a physical assault, a person did not die, but again you have to know how the injury occurred, what was kind of the physical assault. And battered baby we will be talking about in child abuse. Okay, so this term battered baby is used in child abuse. You have to examine that as well. And drunkenness case it's in clinical forensic medicine. Assessment of degree of permanent disabilities following factory accidents of workmen for compensation. In a civil cases or if a person is disabled in factory accidents, a person that workman can ask for compensation. False allegations or examinations are to be done. Now, as I said that it's not just forensic medicine, but toxicology. Toxicology pharmacology basic science, so it's somewhat related with pharmacology. But again, we have to know just about the poisons, right? So alikati simpler form of pharmacology. So it deals with the sources, characters, properties of poisons, the symptoms they produce, the fatal effect, fatal doses, and the remedial measures that should be taken to combat their action and effects. So toxicology ma ke parnu paryo ta timarle bhanदाखेरि एउटा you have to identify the poison. All right, so identification कसरी गर्ने? By knowing the properties of a poison. And after taking the poison, what are the symptoms? And like pharmacology, what are the symptoms they produce? And certain death hunako lagi kati poison is required, 1 gram, 2 gram, or 0.5 gram, कति required so so fatal dose and the fatal effect कति period of time ma person might die will the person die within an hour or 24 hours or it'll take a week's time so fatal period fatal effect you should know that. And then finally, not just knowing the fatal dose period symptoms is enough, but you have to know the treatment as well. Treatment in that case of poisoning and the action or effect. If that person has died, then what are the postmortem findings? Okay, postmortem findings. त्यो बाहेक पनि अझै definition, this is not complete, which we will be learning in forensic toxicology itself. त्यो बाहेक पनि you have to know the quantitative and qualitative measures as well. कति चाहिन्छ, कति quantity हुनुपर्छ poisoning को लागि. अब कतिजनाले सुसाइड गर्नलाई 10 वटा सिटामोल खाइदिएर मैले सुसाइड गरेँ भनेर भन्न सक्छ हैन. So is 10 citamol tablets is enough for committing suicide or more is required, qualitative and quantitative measures are pani थाहा हुनु पर्यो, so that is related with forensic toxicology. A perfect definition नभए पनि I just want you to have some basic ideas about the subjects. Next is forensic thanatology. Forensic thanatology investigates the mechanisms and forensic aspects of death. Okay, so bodily changes that accompany death, the postmortem period changes. Okay, so कस्तो हुन्छ भने after death there are certain changes. If anyone can answer what are the changes that takes place after death, I would be happy if you answer.
Rigor mortis and cold body.
Okay, very good, very good.
Blue discoloration.
All right, blue discoloration.
Rigor mortis.
Rigor mortis, very good. Okay, मैले तीनटा आन्सर भेटाएँ हैन. एउटा cold body turns into body turns cold and immediate change. Okay, cessation of respiration ले के थाहा पाउँछ, death has occurred भनेर, so thanatology मा very good. I'm so impressed, तिमीहरुले at least attempt गरिराछौ. Okay, so that is what I just want. खाली तिमीहरु interactive छ कि छैन. Basically, as a teacher, I just want you to know if you're there or not. Visual, physical classes भएको भए I would know that you are in class. Mind कता जता भए पनि अब त तिम्रो mind पनि छ कि छैन, physically present छ कि छैन त्यो पनि थाहा हुँदैन. त्यसैले I just want you to interact with me. Perfect answer चाहिदैन मलाई. So I would be happy if you participate. All right, as a participant, if you participate, I would be happy. Anyways, so after death, certain changes takes place. Initially, body turns into cold. About cessation of respiration. First, you have to know if death has occurred or not. How do you know death has occurred? Cessation of respiration, cessation of circulation, and when a person cessation of nervous system. Tinta tripod of life. Tinta bhayepachi, if all three ceases, then we declare that person dead. So thanatology ma it starts from there. Right, so immediate changes, immediate changes के हुन्छ, त्यसपछि आउँछ early changes ma turns into hypothermia हुन्छ, cooling of a body हुन्छ, त्यसपछि bluish discoloration भन्छ एकजनाले भनेको थियो. Now yes, there will be discoloration, color change in the dependent part of a body, that is known as liver mortis भन्छौँ हामी. Okay, so liver mortis पछि then it changes into rigor mortis. अघि कुलिङ अफ अ बडीलाई हामी algor mortis भन्छौँ हैन. So all three mortis occurs, that is algor mortis, liver mortis, and finally rigor mortis, that is stiffening of muscles. अब यो मलाई तिमीहरूलाई एक्सप्लेन गर्न किन फिजियोलोजीमा तिमीहरूले पढेको होला हैन यति राइगर मोर्टिससम्म. त्यसपछि लेट चेन्जेस स्टार्ट्स द्याट इज डिकम्पोजिसन. डिकम्पोजिसनमा पनि सर्टेन भेरिएसनहरू हुन्छ. अगेन त्यसपछि फर्दर स्केलेटनाइजेसन हुन्छ. Okay, so all these are included in forensic thanatology. What are the bodily changes that accompany death and the post-mortem period changes? Now, why do you think you need to find out the time of death?
इन्भेस्टिगेसनको लागि हेल्प
टाइम अनुसार म्याम बडीको रेस्पोन्स चेन्ज हुँदै जान्छ. त्यो पुट्रिफेक्सनहरू अनि
Putrefaction भने थाहा कसले आन्सर गर अनिल हैन एकछिन है अनिल. प्युट्रिफ्याक्सन भने के हो?
डिकेइङ अफ द बडी त्यो कति टाइम पछि भइरहेछ
त्यसलाई हामी प्युट्रिफ्याक्सन भन्छौँ हैन. आई जस्ट वान्ट योर फ्रेन्ड्स टु बी क्लियर हैन. प्युट्रिफ्याक्सन र डिकम्पोजिसन. अब टाइमिङ किन इम्पोर्टेन्ट छ डिकम्पोजिसनले? डिकम्पोजिसन थाहा पाएर कसरी हाउ डु यु नो द टाइम? Any idea? Okay, अब राइगर मोर्टिस कहिले स्टार्ट हुन्छ भने अब सपोज हैन suppose rigor mortis starts in 8 to 10 hours or 12 hours. It depends if it's summer or winter, if it's in a tropical country or in temperate zone. You know, त्यसले पनि vary गर्छ. Factors play an important role in changes, postmortem changes. Okay, so summer भयो अथवा it's in a tropical country, then the bodily changes occurs rapidly. Okay, so राइगर मोर्टिस स्टार्ट हुनलाई 1 to 2 hours लाग्छ. डिकम्पोजिसन हुनलाई 18 hours लाग्छ. भने त्यो 18 hours मै हुन्छ. त्यो जोनमा कति आवर्स लाग्छ? त्यो विन्टर या समरमा कति टाइम पिरियड लाग्छ हैन? And if someone claims that that person was killed in that period of time, by estimating the postmortem changes, we postmortem changes ko timing hereर we can correlate the timing. So you just write down what examination you have done, and correlation is done by someone else. And if that person asks, lawyer le अथवा judge le, if you ask that your time period ma if that person has died or not, is it possible or not, you can give opinion on that. Okay, so that is how it is related.